If you wake up with a headache in the morning, if you wake up with your mouth is dry, or if you wake up at night to urinate, if you have 1 or 3 of those symptoms, your chances of having a breathing disorder are close to 90% or greater, unless you have some other, what you believe to be very good explanation. And I would challenge most people to tell me that the nocturia, their explanation of, well, I drink a lot of water, or I've got a sensitive bladder, or I'm taking a medicine, or I've got a prostate problem. We've seen all of those. And very few of those turn out to be very relevant. Isn't that amazing? And when you see why, maybe it'll all come together for you. This is the explanation. I'll give you about 20 seconds to read it, and I'm going to show you with a few fairly clear graphics. Okay, so here it is. Just imagine yourself trying to breathe. You're struggling, right? You're trying to get the air in. There is some kind of obstruction in your airway. Naturally, there's going to be greater pressure inside the chest wall. That greater pressure inside the chest cavity pushes on the blood supply in the venous system that is heading back to the heart. Blue is venous. Let's see. When the right heart receives this venous supply, the right atrium expands because it's getting more fluid than it's used to. And the right atrium is designed to detect what's called fluid overload states. Now, quickly, is the fluid in this person's body overloaded? No, right? Everybody gets that. It's not overloaded. But what does the right heart think? It thinks it is overloaded because it received too much fluid throughout the course of the night. The right atrium has muscles, heart muscles in it. Each cell in those muscles can secrete a hormone. The hormone is called atrial natriuretic peptide. That peptide is a diuretic, which makes perfect sense, right? If the body thinks it's fluid overloaded, the kidney should cooperate to help reduce the amount of fluid in the body. Not that it's going to be the short-term solution, because the body might do something else, but the long-term solution, that's how the kidneys operate. They've got to do something to release this extra fluid, even though it's a false fluid overloaded state. The kidneys make more urine all night long. They send that urine to the bladder. Depending upon the sensitivity of your bladder, you will wake up at night to urinate. Put this patient on CPAP, even put some of these patients on nasal strips. And this cycle will be reduced, if not completely eliminated. In fact, one of the signs of optimal treatment from a sleep center should be that you stop waking up at night to urinate. And it's a pretty amazing thing, because if you've been waking up at night to urinate once, twice, 3 times or more, and then you use a treatment that makes that go away, that's a pretty impressive thing, and it's also a very good motivator for a lot of people.